So today I'm talking with Dr. Bridget Walker. She's a well-known expert on child and adolescent anxiety disorders. Dr. Walker, thank you for joining me today. So what I wanted to discuss with you are the recent findings of a major U.S. task force on child and adolescent mental health. If I'm to understand it correctly, this task force has for the first time ever issued a recommendation that children between the ages of 8 and 18 be screened for anxiety disorders. This, as a parent, I found very alarming. Does this surprise you?
Well, frankly, I was relieved and glad that people are aware of how prominent and how common childhood anxiety disorders are and how disruptive and difficult they make children's lives. So I'm very pleased. Immediately, though, I started getting calls from pediatricians and things like that asking me, well, what do we do about this and how do we screen and what measures do we use? So I think it's a great thing because this means more kids can get help.
Is this something that you associate with the pandemic, or is this something that has been growing and has been a prevalent concern among practitioners such as yourself for some time?
I've been treating kids with anxiety issues for 3 decades, so I'm always busy. So there always have been a high percentage of kids who suffer from anxiety and related disorders. But I would say that things like the pandemic changed kids' lives dramatically. And when you change the lives of kids, the daily lives, things that trigger them change, and it has a big impact on them, as has the prominence of social media, and kids spending hours and hours playing video games. And there's a lot of things that happen that then contribute to anxiety issues.
You mentioned earlier that kids have always had anxiety disorders, and in fact, anxiety disorders are fairly common. Is there a percentage we should be familiar with?
Yeah, the CDC estimated that 8% of kids have anxiety disorders. I think it's much higher. Most people who do what I do think it's more around 20 to 30% of the population. So it's really common. That means in a given classroom, there are always going to be a number of kids with anxiety disorders.
So this concept then of asking pediatricians to start screening for this, if the numbers are as high as you say, it's almost like a regular health check.
Well, right. I mean, the pediatricians with whom I work, one of them said to me, we're seeing a lot more kids with anxiety disorders and strep throat, and they are on the front line. So when you go for your child visit, the pediatricians are going to be the ones asking you about developmental milestones, and they're the first ones who generally see these issues.
So let's talk about what this screening would entail. So how do I make that decision? Should my child be screened?
Yeah, that's a really good question. I don't know if it's realistic that pediatricians screen every single kid. I think more likely if they see signs of anxiety that then a pediatrician would screen, and what measures they will use we're not sure of yet. But parents and anyone listening to this interview, there's a lot of signs of anxiety that some are really obvious and some are not so obvious. So if you can educate yourself, for example, by going to my website, reading my books, you can get a sense of what anxiety looks like in kids.
Fantastic. So it sounds to me like there's a framework that parents can refer to. So can we break that down? So let's say I'm a parent of an 8-year-old or a 10-year-old or a 12-year-old. What should I first consider or look for?
Well, so think about what's typical of a kid that age, and what their classmates are doing or not doing, and maybe your other children. So signs of anxiety that are obvious are outright statements of fear. Like if you're at a park and a dog runs up to your child and your child jumps into your arms, that's pretty obvious that the kid is afraid of dogs. Or if your kid is worried about germs and asks you to clean his fork and knife before he uses it, or is it okay? That's pretty obvious. But there are a lot of signs that are much less obvious that people miss. Avoidance is the first thing that people will do when they're anxious. So if your kid doesn't want to go to a birthday party, a pizza party, a carpool, and it could be that they have fears of any number of things that are associated with those things. If your kid is really irritable, especially about doing things that he or she's uncomfortable with. Anxious kids can get very aggressive and violent. They're pretty much willing to do anything to avoid being in a situation that freaks them out. Kids can even threaten suicide. If you make me go to that piano recital, I'll kill myself. When they really aren't going to kill themselves, but they really will do anything to avoid. Extreme shyness. Also, yes, kids go through phases of shyness, but we're talking about much more extreme for a given age.
It's interesting because you're using the word phases, and I had a question about some of the behaviors that you mentioned. So for example, avoidance. Is the avoidance sudden? Like, if my child normally would be happy to go to a birthday party or normally was doing fine going to a day camp, for example, do I look for a shift in behavior?
Well, it can come on suddenly. Because anxiety disorders can come on suddenly, or it can come on gradually. Usually though, it'll start with something and then grow into similar situations. So it might start with, I don't want to go to the birthday party. Well, now I don't want to go to the football game. Now I don't want to go to the pizza parlor with the class. So it usually starts gradually and then can grow really quickly.
So we have behaviors, so that's one thing to look for. Are there other factors that I should be investigating or looking at as a parent?
Well, yeah, I think there's a number of risk factors, and what I see and what studies show is that these disorders tend to run in families. There's a really strong genetic component. So if you have a history of anxiety, family members, grandparents, there's a high likelihood that your kid does as well, and it doesn't have to be the same kind of anxiety. And the thing about anxiety disorders is often people can function really well, but relatives might be perceived as slightly eccentric or unwilling to do certain things, or they can arrange their lives in a way that they don't have to do the things that freak them out. So family history is the number one risk factor. Parents who have anxiety issues themselves tend to also engage in what we call accommodation behavior. So they'll allow their kid to avoid things, or they'll call Johnny's friend before a play date to make sure the dog is put away or crated. And parents who engage in those behaviors, what we know is that the more a parent engages in accommodation behaviors, the worse the child's anxiety disorder is. So if you look at yourself as well and how you respond to your child, that can sort of give you some indications as well.
So I'm hearing change or modifications in behavior. I'm hearing family risk factors. And that's interesting. We've been taught a protocol of looking into histories of cancer, histories of heart disease. This is the first I've heard of looking at a history of mental wellness.
Yeah, well, mental illness is just like physical illness. It's a part of all of our lives, and a percentage of our population suffers from mental illness, and most of us at some point in our lives will have some sort of mental illness issue, and it shouldn't be something that's stigmatized. It's part of life.
Thank you, Dr. Walker. This has been incredibly informative for myself, and I'm sure for our viewers at home. In addition to the two books that we spoke about earlier, your child-focused book, Anxiety Relief for Kids, and your teen-oriented book, Social Anxiety Relief for Teens, how might people get more information on this really important topic?
Well, you can go to my website, childanxietyscreening.com. You can go to my general website, drbridgetwalker.com, and on both websites there are many, many resources in addition to those that we've discussed so far.
Fantastic. Thanks so much.
My pleasure.